This is Deborah, and I'm starting my head to toe assessment. Hello, Miss Bree. My name is Deborah, and I'm the student nurse from Vernon College. And I'm here today to do an assessment on you. Is that okay with you?
Yes, ma'am.
Okay. The first thing I'm going to ask is, do you know why you're here today?
Just a checkup.
To do just a checkup. Very good. So what I'm going to need to do is check for some abnormalities. And in doing that, we're going to have to set you down, change positions frequently. Is that okay with you?
Yes, ma'am.
Before we get started, do you need to empty your bladder?
No, ma'am.
Okay. Could you tell me your name and date of birth?
Bree and 11/14/97.
Very good. And do you know what day it is today?
Tuesday.
Very good. Could you tell me who the president is?
Trump.
Very good. All right. And we're going to get started. So I do know that she is alert. She is oriented. I can see by her presentation that she is well groomed. She's clean. And we're going to start with your skin. First thing is, could you just hold your hands out for me? All right, very good. I am testing your capillary refill, and if you could just turn your palms over. So her nails are clean and short, and she has good capillary refill that's prompt. I'm going to be looking at her bony prominences on her arms. No skin tears, no bruises, no anything like that. If you could just look to the side for me. Okay, very good. Thank you very much. And then we're going to start, if you don't mind, I know you've got your hair up. So do you have any problems with your head? Any nodules or anything I need to know about? Okay, so I'm just going to be palpating on her head for any kind of nodules or anything like that. And down your neck, any soreness or anything like that?
No, ma'am.
All right, if you could take your glasses off for me. Thank you very much. And I'm seeing that her eyes looking at me are symmetrical and they're good. So I'm going to need to look in your sclera, palpate your lacrimal apparatus, and you'll feel me just pulling on your eyes a little bit, okay? So looking down, and you can just roll your eyes around. The conjunctiva is clear and her sclera is clear and moist. And then up, down, okay? And then we're gonna test your cranial nerves. So if you can, smile at me, show me your teeth, okay? Stick out your tongue, blow out your cheeks like that, very good. And that's cranial nerve 3 and 1. Okay, while we're also going, if you could go ahead and do your, I'm gonna go ahead and also look at your nose. So the nose is symmetrical on the face. And I have my pen light and all my things that we need to do here. If you don't mind looking up, I'm gonna look inside your nose. Make sure that we don't have any nodules or anything like that. No deviations, any pain from anything like that. Okay, if you can, just put your finger up and kind of blow the other side. We're checking for patency. And then the other side. Very good. Now I'm going to check cranial nerve number 1. This is smell. And if you will just close your eyes for me and then tell me, just take a sniff and tell me what you smell.
Flowers.
Okay, so cranial nerve number 1 is intact. Very good. Now we're going to move down to the mouth. And if you will, again, smile for me. Okay, no problems with the teeth. We're looking here, if you will. Stick out your tongue. And I'm looking in the back of the throat. Say "ah" for me. And I'm looking for tonsils and the uvula. I'm also checking the inside. The mouth is supple and moist. Her buccal. And stick out your tongue. And then lift it up. Very good. The underneath. Stick it out one more time. Push against the tongue depressor. Good. That is a cranial nerve test as well. And if you'll stick it out one more time, I'm going to look at the side and then at this side. Very good. And we can trash that. All right. So we've done that. Now, I see you wear glasses. What I would normally do is we would have a Snelling chart to text your vision, but since we don't have that, and you wear glasses, can you tell me, are you nearsighted, farsighted? Okay. What I'm going to do now is I'm going to do the pen line in your eyes, and we're going to check for dilation. Okay? So just look straight ahead for me. Okay? That pupil dilated, and that pupil dilates. Very good. And then if you'll look over here at the mini blinds, and if you just focus on those, and then I'm going to put my pen right here to check convergence. If you will look back at the pen, and then look again at the mini blinds, and then back at the pen, and then at the mini blinds. Okay, so her pupils are dilating that way. Now if you can just follow the pen light, and that is accommodation. Very good. Now we're going to check cranial nerve 3, 2, and 6 by my cardinal, the cardinal vision points. And what I want you to do is just, I keep putting my hand on your head, sorry. If you would just follow the pen with your eyes, don't move your head, just follow the pen with your eyes. So, goes this way, okay, this way, down, up. Very good, okay. Thank you very much. While I'm standing here, I'm also going to go ahead and look at her ears. We're going to check to look at the ears. And first of all, I'm checking the lobules, the auriculas, the tragus on either side. And then if you don't mind turning your head, I'm going to be looking in the ear canal for any kind of drainage. None there. Doing that bilaterally to any kind of drainage. And now we're going to do the Weber's test. And what I'm going to do with this is you're going to feel, or you're not going to feel me. I'm going to hit the hammer, and I'm going to set it here on your forehead, and I want you to tell me if you can hear it in both ears. Okay? Can you hear it?
No.
In either ear?
No.
Okay. I might not have hit it hard enough. So we're going to try again. Wait.
No.
No?
No.
Okay. That's okay. If you're not hearing it, I'd rather you tell me you're right.
Could be the headband.
Can you hear it?
No.
All right. Try taking your headband off.
Maybe I'm deaf.
I don't think you're deaf. Maybe I'm just not hitting it right.
No. All I hear is the air conditioner.
Okay. Now, then we're going to try the Ryan test, and what this is going to do is that first I'm going to hit this again, and then you're going to feel me put it right here. Hold your head straight. You're going to feel me put this right here on the mastoid process, back here in your ear, okay? And what this does is it checks the conduction of air, so you tell me when you can't hear it anymore, and then I'm going to move it, okay, to the front of your ear. So it's not a hard test for you. All you have to do is just tell me whether you can hear it or not. So, oh, I can't touch it like that. Can you hear it?
Yeah.
Okay.
Now I can.
Okay. All right.
Yeah, I can hear. Now I can.
Okay. Now we're going to do this side the same way. Hmm?
No.
Can't hear it?
Mm.
Okay. Hang on. Let me do it like I did it before.
Now I can't.
Okay.
I heard it at first.
Okay. Now I can't.
Now I can't.
All right. Very good. And we did that. Okay. Now I'm going to check your cranial nerve number 5. It's just a Q-tip. I see your eyes bugging all out. So what I'm gonna have you do is close your eyes. I promise I'm not gonna poke your eyeball. Trust. All right?
That's a big word.
Okay. Promise. So what I need you to do is tell me whether you feel sharp or dull, and we're testing cranial nerve number 5. Okay? So
Sharp. 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 Dull. 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 Dull.
okay. Thank you very much. All right, we did the ears. All right, now the next thing we're gonna do is, I'm sorry, I need to do the whisper test. So you can stay where you are, and I'm gonna go behind her. This is again, it's another auditory test. It is to check the cranial nerve for hearing. So if you would cover this ear and repeat what you hear me say behind you. This is the whisper test. Thanks.
Huh?
Baseball.
Baseball?
Okay. Now, you'll trade hands. Cover the other ear. Football.
Football.
Very good. Thank you. All right. Okay. We're going to move on. I'm going to check your neck and I'm going to be feeling your lymph node glands, okay? So back here, we have the occipital lobes and the lymph nodes, and we come around to the mandibular lobe, the tonsillars, and then it comes down to the submandibular and the subclavian, and okay, these are the, checking your lymph nodes also. And then these are the deep reflexor. So I'm going on the front side is the anterior, and then the posterior of her lymph nodes, and I don't feel any masses. And if you'll just shrug against my shoulders, like lift your shoulders up, I'm gonna do the subclavian nodes. All right. Also, I'm gonna be feeling your neck for your thyroid. And do you have any thyroid problems or anything like that?
No.
Okay. Can you swallow for me? All right. Very good. I felt that. I'm going to step behind you, and I'm also going to check her thyroid from behind. And you're going to feel my hands on your neck. And then can you turn your head to the right? Okay. And then turn it again to the left. And then back to the center. Very good. All right. I'm coming back around here. And what I'm going to have you do now is if you can lay back, I'm going to do your...
Can I put my glasses back on?
Yeah, you can put your glasses back on. I'm sorry. Should have had you do that. I am going to raise the bed up. Be lazy. It's not very often you get to do this, huh? Okay. What I'm looking for, if you can put your arms down, is I'm going to be looking on your shoulders area here, and I'm checking for jugular vein distension, and I'm looking for anything like that, and I don't see any bulging or any of that. So I'm gonna look over here on this side. I'm gonna come around there, Crystal. All right. All right. Very good. All right. Don't see any jugular vein distension, so that is good. And while I have you laying down, because I think that it's better to see this way, I'm going to go ahead and, no, I need you to sit up. Sorry, my bad. I do need you to sit up on the side of the bed. Because the next thing that we're gonna do is we're gonna check her thoracic area. So I'm gonna check, you're gonna feel me put my hands right below your ribs, right here under your bra area, because I'm checking for symmetrical breath. So take a deep breath in and out. Very good. And her chest rises and falls and everything does symmetrically. Okay. Now, what you're gonna do is I'm gonna check for it's called fremitus. So you're gonna feel me putting my hands on your shoulders, and each time I move my palm, if you'll say the word 99, and what I'm checking for is the vibration that I can feel in my palm. It's called fremitus. So go ahead.
99, 99, 99, 99.
Very good. And then I'm going to move around to the back side. And I'm going to also check for the fremitus here. And it's the same way. As I put my palms, if you'll repeat 99,
99, 99, 99, 99, 99, 99, 99.
Okay, very good. Thank you very much. And I'm just doing the spine, kind of checking that. All right, while I'm back here, I'm going to go ahead and I'm going to start with listening to your lungs. Okay, I'm going to listen. And each time you hear the bell or you feel the stethoscope move, if you can just take a deep breath in and out. Very good. Okay, and I'm going to come around to the front, and I'm just going to continue, and I'm going to listen to your lung sounds. I'm going to listen to your lateral lung sounds. And then over here, deep breath. All right, very good. Now, I'm going to go ahead and listen to your, I'm going to palpate your carotid arteries, okay? And then I'm going to listen in the front for your thyroid, for your bruit. And that's just for the video. First I'm gonna palpate your carotid on this side. And then over here on this side. Okay, now I'm gonna listen to the carotid on both sides. With the small side. And then over here. Okay, I'm also listening. Okay, very good. Now I'm going to listen to your, this is getting caught on my mask. I'm going to listen to your heart sounds. Make sure I got this on. And with this, I'm going to listen on both sides. And I'm going to start, this is counting down 1, 2. I'm listening here to the aortic. Pulmonic. And then Erb's point. Then to the tricuspid, sorry. All right, and to the mitral. And I would listen to these for 1 full minute. And we do listen with both sides of the stethoscope. Okay, then coming back up. I'm just showing that I, know to use both sides of the stethoscope. Okay, now if I could have you lay back on the bed. And now, what I'm gonna do is, first of all, I'm not gonna lift your shirt, but what I would be looking for is anything. I'd be inspecting the abdomen, making sure that your navel, is center midline, that you don't have any open areas or anything on your skin. Do you have any problems with your stomach at all? Okay, I'm gonna go ahead and I'm gonna listen to your bowel sounds first, and then you're gonna feel me, and then I'm gonna percuss, and then I'm gonna lightly palpate, okay? So I start at the right lower quad, and we go to the left lower quad, right upper quad, across to the left, and to the left lower. Okay, now in the center, I'm going to listen for the aortic, and then the iliac, and the renal. And I'm also going to go ahead while I'm here and listen to your femoral. Okay. Now, while I have you laying down, I'm going to go ahead and I'm going to percuss. Okay, and now I'm going to start with just a soft palpation. So let me know if you feel any tenderness. All right. Okay, now I'm going to go ahead while you're laying down, and I'm going to check the rest of your pulses. So you're going to feel me. I'm going to do your femoral pulse, and then I'm going to go down to your popliteal pulse, and then we're going to go down to your feet. And as I'm going down that way, I'm going to look at your legs for any kind of swelling or anything that, all while I have you in the lying down position, okay? So this is the femoral pulse. All right. And then I would check the other side as well. Okay, and behind the knee is the popliteal. And then I would also do this side. Okay, and this is the dorsal pedalis. And I'm checking these to make sure that they're both equal. And I can feel them both. And then the tibial right up from the malleolus, or right behind the malleolus. Okay, I'm going to take off your sock so that I can look at your toes. Can you wiggle your toes for me? Okay. And do your toes. Okay. Very good. Okay, if you can, and I'm going to have you, what I would also do is have you roll to this side. If I were a patient, I would be worried, because what I'm going to come around here and look for is sacral edema. And so I'm looking right down here in this area, and I'm checking in your sacrum area to make sure that you don't have any edema, and I don't see any. Very good. Okay. Now, if you could come back up to the edge of the bed. I am going to use we're going to check your reflexes. I won't hit you on the head with this, okay? I'm going to do your brachial, and we're going to do your ulna, then we're going to do your knees, okay?
I would stand over here for the knees.
For the knees?
Yeah,
You going to kick me?
I might.
Okay. Just relax your arm. Okay, and roll it in. Okay, going to do this one. And then, okay, now we're going to do just relax. Very good. Okay, so I did look at the legs, no edema or anything like this. If you could, I'm sorry, what?
So they're just hairy.
Can you take your heel and run it down that shin? Very good. And that heel to that shin. Very good. And if you could stand up for me, what we're gonna do is, this is called the Romberg's test, so I want you to close your eyes, and I'm gonna be right here in front of you, I'm on the lunch call. So close your eyes and then just put your arms out beside you. And if I'm looking for her to be swaying or anything like that, and she is not, so that's a good sign. And then what I'm gonna have you do, you can open your eyes and put your arms down, and I'll show you, is you can turn this way, since Crystal's right there, and if you will do heel to toe, about 3 steps. That way, okay, and then you can turn and just walk back normal. All right, and that's your gait. And if you will have a seat. I did not palpate her back, so I'm gonna go ahead and no, you can stay sit down. Because what we would we would percuss your lung fields. And then I would do the same on her back. I would start with my percussion here at the top, and I did the fremitus, but I left out the percuss. All right. And I think we have covered the whole head to toe assessment, and I appreciate it. Thank you so much. That's it.